Hi, this is part 2 of my video where I am sharing with you my very own story of what it is like to experience getting myself diagnosed firsthand with the metabolic syndrome and thereafter successfully trimming myself down from being overweight by losing a total of 20 pounds within 2 months back to my normal BMI of around 22 to 23. This is my ongoing advocacy to help educate the general public about metabolic syndrome and insulin resistance. Watch and like this video. Do share it with your friends to help them out. And don't forget to subscribe to my Low Carb Health Doctor channel. Perhaps because I was becoming more aware of and more sensitive to the conditions I was having. It was also at that time that I became more perceptive on social media how certain overweight and obese people doing this thing called the, ketogenic diet, were losing a significant amount of weight. I thought, is this a new fad diet? If so, why are they losing much weight? What's with them? Surely, there should be some biochemical and physiological mechanism that's working in them. So, this got me all the more curious and I did more research about it. And that's how I came across a number of non-mainstream scientists who explained in detail the mechanisms of this phenomenon called the metabolic syndrome, as well as its underlying condition called insulin resistance. The lectures and research activities of such low-carb luminaries like Dr. Robert Lustig, the cell biologist Dr. Ben Bickman, the sports nutrition expert Dr. Timothy Noakes, were really very helpful to me. Of course, there's also Dr. Stephen Finney, the nephrologists, Dr. Jason Fong he's a Canadian, and Dr. Richard Johnson, and many others who are currently doing their best advocacy in spreading this truth against what mainstream medicine has taught us through the recent decades. I encourage everyone to listen to their talks. If you're a lay person, it would be quite interesting and not really that difficult to understand the concepts they're talking about. But if you're also a fellow physician or one of my medical colleagues, why not do yourself a favor by listening to their talks? Perhaps you can do your own readings and research above and beyond what we have been taught by our clinicians in medical school and in various training institutions. Perhaps why not try to look at your own self? What's your BMI? Have you been gaining more and more pounds through the years? Is your belly getting bigger and bigger? Are you now overweight? Perhaps even obese? Are you finding it hard to shed those extra pounds that you have gained? Go look at your own blood tests. I would not be surprised if quite a number of you also qualify for the metabolic syndrome criteria, like how I did. Lately, with my own heightened awareness, and especially since I realized that I've had it myself, I've been diagnosing more and more of my patients with metabolic syndrome, and the improvements they are having with the proper interventions I've guided them with are truly fantastic. I've been doing these therapeutic dietary interventions myself for some time now, and I've seen and experienced the immense benefits I'm continuously getting firsthand. So I really don't find it hard to advocate for it and to teach it in a way that they would easily understand. It takes some time though to explain all of these things, which is really paradigm changing for most. That's why I came up with this channel, so that I can just tell my patients to watch my videos and save much of my precious time doing so. without having to explain it over and over again every time I hold clinic. After integrating all that I have learned about metabolic syndrome and insulin resistance, believe it or not, I gave myself this big challenge. Why don't I strictly do the very low carbohydrate ketogenic diet, or VLCKD, myself and find out what happens? If it works, then eureka! That would be one of the greatest things that could happen to me so far. Anyway, I thought, I know for a fact that I have been almost obsessively complying with the so-called low-fat, low cholesterol, and allegedly healthy diet for years. In fact, the so-called dietary pyramid has been repeatedly hammered into my consciousness for so long, yet it seems like I honestly wasn't feeling any healthier all throughout those years that I was adhering religiously to it. It also shows in my blood tests. They were not really that good, even quite despicable. My triglycerides were way up. I was hovering in the borderline zone above 100 milligrams per deciliter for fasting blood sugar. And my uric acid levels were always beyond the upper limit of normal. So, what have I got to lose if I attempt at least to duplicate what a number of these medical and non-medical keto personalities have done for themselves? So one day, I finally got fed up with the usual things that I have been doing for my health, and I made this crucial decision to experiment on my own self what a strict low or very low carbohydrate ketogenic diet can do. On top of that, I also decided to abruptly stop my medications to really figure it out if this diet works or not. That day, I decided to stop eating rice, bread, oatmeal, and all the other high carbohydrate food sources I have identified in my day-to-day diet. Of course, suffice it to say that all sugar-containing foods became taboo for me. What became staple are seafoods, poultry, pork, beef, eggs, and all non-starchy, leafy, green, so-called above-ground vegetables. I had lettuce, cucumbers, and other greens for my salad. Of course, I sprinkled it with a dash of dressing filled with healthy fats, and every now and then with some Parmesan cheese and some nuts like pecans and walnuts, at times also some peanuts. When I started on my ketogenic diet journey, I don't really feel that very strange at the onset. I was quite satisfied with my food. They were, well, tasty. Not abhorring, not really. And in fact, a number of them can be called gourmet food. I felt contented because I was not restricting calories. My dictum was to eat mindfully until I felt full, and to stop eating once I am satiated. The hunger pangs soon came far longer in between, and true enough, I realized it was the carbs in my diet before, especially the refined carbohydrates like sugar and flour, that made me feel hungry again about 3 to 4 hours after my main meals. Thus, I often had to go grab some snacks in between. It was all because of the rise of this hormone called insulin. Yeah, insulin from the pancreas that after every carbohydrate-rich meal, which brings down my glucose fast and which makes my body feel the fatigue. And thus, I had to go look for something to nibble once again. In the long run, that effectively makes me frequently hyperinsulinemic, thus eventually leading to my insulin resistance. As you can see, our body does its best to maintain a sense of balance or homeostasis. It does this through some kind of feedback mechanisms. For instance, we We feel hungry because of this hormone called ghrelin. It comes from certain cells in the linings of our stomach. Then there are other hormones such as this one called leptin that is produced mostly by our white adipose tissue or fat cells when our body has sensed that we have already ingested enough nutrients from our meal. Leptin is supposed to appease our hunger or promote our satiety. When we eat foods high in sugar and highly processed, refined carbohydrates, which are all those foods made from wheat flour with much less dietary fiber, like white bread, pizza, as well as snack chips, french fries, and the like, our blood sugar levels go up fast and our insulin levels correspondingly shoot up. Because of insulin facilitating the entry of glucose into our cells, our blood sugar levels plummet. Then a bit thereafter, we feel hungry again. Ideally, there should be ample times in between for our insulin levels to go down. However, when we frequently eat carbohydrate-rich foods, which within only a few hours of each other, our insulin levels remain frequently and almost continuously elevated. With this chronic elevation of insulin, our body eventually develops insulin resistance. With chronically high insulin levels, especially in the background of frequent intake of refined carbohydrates, we often feel hungry over and over again. Thus, all the more we tend to eat more frequently. And since insulin is an anabolic hormone, it promotes lipogenesis or the formation of triglycerides from fatty acids and their corresponding deposition or storage into our fat cells or adipocytes, as well as de novo lipogenesis, which is the conversion of carbohydrates like glucose and fructose into fatty acids. That's how frequently high insulin levels or hyperinsulinemia, mostly due to insulin resistance, may promote obesity. Thereafter, some other things could happen further. Insulin can promote the secretion of leptin, which is what is called one of the major satiety hormones. Frequent elevation of leptin can also lead eventually to the development of this thing called leptin resistance, which is again contributory overall to the phenomenon of obesity. What happened to me after I maintained a low carbohydrate diet? Well, it was amazing, almost unbelievable. After about 1 week of maintaining low carbohydrates, my blood pressure levels constantly remained within normal, about 100 to 110 systolic over 60 to 70 diastolic, despite me not taking any medication. In a matter of a few weeks, I noticed a significant level of weight loss. This weight loss was sustained. In just about 2 months, I lost a total of about 20 pounds or about 9 kilos. From a body mass index or BMI of about 28, it went down to 24. I was overweight. Well, not really that yet obese, as you might say, but I already fulfilled the criteria for metabolic syndrome. I had some further weight loss thereafter, and now my BMI hovers somewhere between 23 to 24, which is within a healthy range. I monitored my important blood chemistry parameters, and again, it was truly amazing. My triglyceride levels gradually went down to normal, and my fasting blood sugar levels eventually settled below 100 milligrams per dl. My triglyceride over HDL ratio also dramatically improved. And one other important thing worth mentioning is this. my blood uric acid levels, which had always been chronically high in the past, it became sustainably normal. And that was even when I stopped my hyperuricemic medications like febuxostat or allopurinol. Previously, I was on allopurinol. I used to think that my elevated uric acid was mostly due to foods rich in purines, and that's why I minimized my intake of those foods like legumes, peanuts, certain seafoods, and some meats. But I found it initially conflicting that even though now I frequently eat precisely those foods, peanuts, meats, pork rind, or what we locally call chicharron, now my serum uric acid levels became normal. It was later on that I learned that sugar and high fats, especially the fructose content of certain processed carbohydrate foods, were indeed much of the culprits behind the elevation of my uric acid. Of course, my waistline got trimmed down, my old trousers and pants that I could no longer use, those which used to fit me more than 15 years or 10 to 15 years ago, now I can easily fit them again. Another added bonus I got is this: a lot of my body pains, which I used to experience every now and then before, they mostly went away. I used to have intermittent mechanical low back pain, which of course usually after prolonged standing or walking, probably because I was already gaining weight. I also had recurrent pain in the soles of both of my feet, what we doctors call plantar fasciitis. That got much improved as well. Now, all those body pains and aches that I used to have, including my recurrent myofascial pain syndrome or MPS, which I felt every now and then as painful trigger nodules in my, here, shoulder blades, low back and buttocks, are pretty much negligible now. Of course, I do have the occasional mild musculoskeletal pains, but they are mostly post-exercise muscle soreness, which is at most just transient. But I think that's kind of normal for us all. The moment I highly suspect insulin resistance in any of my patients, I run certain diagnostic tests to understand his or her baseline blood chemistry parameters. Then, when I find it appropriate, I try to offer what I call a medically guided therapeutic dietary intervention. Of course, it's with the use of a low carbohydrate and healthy fat diet. Patient education is also very important for me. I explain to them what metabolic syndrome is. I give them materials to read. Yeah, I made those materials myself. And yes, I really believe knowledge is power. I find it a lot easier to help patients who know and understand the root cause of their illnesses and are subsequently motivated to diligently follow the appropriate and necessary changes in their diet and lifestyle. I would also like my patients to own up to their conditions. I am for self-empowerment. Nothing compares to personal responsibility. A patient who knows how to accept personal responsibility for me over his or her own medical conditions is very important. I usually ask my patients, especially those I suspect of having insulin resistance and metabolic syndrome, how long would they still like to live? Is the reason why they are consulting me here in the clinic is because they are serious about living a longer, fuller, and perhaps healthier life? If so, I tell them that they have to come face to face and acknowledge certain truths, as well as take certain matters into their own hands. I, as their doctor, can only do so much in terms of guiding them towards the proper interventions. They have to be the ones to decide in terms of doing certain things, like sticking to the right diet. Many of them have already been told by their doctors, their other doctors, to have a proper diet, but as to what really is a proper diet, that's often their biggest dilemma. And towards the end, if I find it still helpful and necessary to encourage them in their own journey towards their own better health, I tell them that if I was able to do it myself, that if I was able to successfully control the manifestations of my own insulin resistance, and they prescribe the medications I've been taking related to my metabolic syndrome, then why wouldn't they be able to do it themselves on their own? With self-discipline and armed with the right knowledge and strategies, I would say that for certain there is a light at the end of the tunnel, which is the tunnel that is metabolic syndrome or insulin resistance, especially when caught early on, before the irreversible complications have occurred. Well, perhaps the most important take-home message that I'd like to share with people, especially those who have type 2 diabetes, high blood pressure, or hypertension, those who are overweight or obese, especially those with the metabolic syndrome, which is primarily brought about by their development of insulin resistance, is this: your condition is treatable with a medically guided therapeutic diet, and there's a good chance that your medications can be minimized, or in certain cases, they can even be altogether removed. I'm talking about medications for diabetes, cholesterol, and hypertension. I used to tell my patients that these drugs are already their maintenance for a lifetime, but not anymore. I've realized that they can actually be removed, be prescribed, especially after understanding the root of the matter, that metabolic syndrome is a condition that can be more appropriately described as a dietary complication, that which has been due to eating foods of the wrong kind, in the wrong way, and also with the wrong timing. And this paradigm is especially applicable if you are not yet at that point of no return. What do I mean by that? If your body still hasn't reached that level of having irreversible complications, then perhaps we can do something to reverse your metabolic syndrome. For instance, irreversible damage such as chronic kidney disease due to diabetic or hypertensive nephropathy, complicated liver cirrhosis that has gone far beyond the non-alcoholic fatty liver disease, or perhaps moderate to severe stroke of the brain with persistent neurologic deficits, which I often see a lot in my practice as a neurologist. But take note, I'm not saying that medications are no longer necessary. Of course, there are certain medical conditions that warrant specific medications. Lastly, I'd say be in a trusted partnership with your physician. And also, I really hope your physician is familiar with this paradigm concerning metabolic syndrome and insulin resistance, so that at the very least, he or she can successfully help you out in terms of providing you guidelines for an effective dietary therapy, and hopefully, perhaps even lowering down and even stopping or deprescribing your medications if possible, and if so, warranted. Like this video and share it with your friends to spread the message. Subscribe to my Low Carb Health Doctor channel and hit that notification bell to be updated of my upcoming videos. If you have any questions, leave them below. And if you have any particular topic in mind that you would like me to make a video about, leave your suggestions below. Do subscribe also to my other channel, Neurologs. The link is in the end screen. See you all.